You stand up from a chair, you feel unsteady for a second, you reach for the wall, you tell yourself you just moved too fast, or maybe you are walking down the hallway and you veer slightly to one side. Without meaning to, you correct yourself and keep going. These moments feel insignificant, but what if they are not random? What if they are early signs of a specific physiological breakdown that will progress predictably over the next 5 to 10 years until you fall and fracture your hip? A 2021 study published in JAMA Network Open followed 9,600 adults over 65 for 7 years. The researchers tested balance at baseline using a simple standing test. Adults who could not hold a single leg stance for 10 seconds had a 360% higher risk of death from any cause within the next decade. 360%, not a small increase, not a marginal risk. Losing your balance is not just about falling. It is a mortality predictor as powerful as smoking or diabetes. By the end of this video, you are going to understand the exact biological mechanisms causing balance loss in American seniors. You are going to assess your own balance risk in under 2 minutes. And you are going to learn a physical therapy protocol that has been validated in clinical trials to restore balance function even in adults over 80. If you want information that could prevent a life-altering fall, hit the like button right now. And if you are serious about maintaining independence as you age, subscribe to this channel. Most physical therapists will not spend 20 minutes explaining why your vestibular system is failing and exactly how to fix it. But that is what I'm about to do. So subscribe and let us get into the science. I want to be clear before we go further. Balance loss is not normal aging. It is pathological aging. There is a difference. Normal aging involves gradual changes in reaction time and muscle strength. Pathological aging involves system failures that are preventable and often reversible, and the research shows that most balance loss in American seniors falls into the second category. It is not inevitable. It is a consequence of specific modifiable factors. The research on balance and aging has been consistent for over 30 years. A landmark 1997 study in the New England Journal of Medicine established that balance impairment was the single strongest predictor of falls in community-dwelling older adults, stronger than vision problems, stronger than medication side effects, stronger than environmental hazards. When balance fails, everything else becomes dangerous. A slight unevenness in the sidewalk, a small rug, a moment of dizziness. These things do not cause falls in people with good balance. But in people with impaired balance, they are catastrophic. Here is what makes balance loss particularly dangerous. It develops slowly and silently. You do not wake up one day unable to balance. You lose small increments of function over months and years. Each loss feels minor, barely noticeable, but the cumulative effect is devastating. And by the time you recognize you have a problem, your balance system has already deteriorated significantly. Let me explain what balance actually is. It is not one thing. It is the integration of 3 separate sensory systems. Your vestibular system in your inner ear detects head movement and orientation. Your visual system provides information about your position in space. And your proprioceptive system senses in your muscles and joints, tells your brain where your body parts are. Your brain takes input from all 3 systems or processes it in milliseconds and sends signals to your muscles to keep you upright. When you are young, all 3 systems work efficiently. If one system has a momentary glitch, the other 2 compensate. But after age 65, all 3 systems begin to decline. Your vestibular system loses hair cells. Your vision becomes less acute, your proprioception becomes less sensitive, and the brain processing that integrates these inputs slows down. When all 3 systems are degraded simultaneously, there is no backup and balance fails. A 2018 study in the Journal of Neurophysiology measured this systematically. Researchers tested vestibular function, visual acuity, and proprioceptive sensitivity in adults aged 25 to 85. Vestibular function declined by an average of 40% between age 25 and 75. Visual processing speed declined by 35%. Proprioceptive accuracy declined by 50%. And the brain's ability to integrate conflicting sensory information declined by 30%. Every component of the balance system was failing. Think about what that means functionally. You are standing in a dimly lit room. Your vision is compromised by low light. Your vestibular system sends a signal that you are tilted slightly. Your proprioceptive system sends a conflicting signal that you are upright. Your brain has to decide which input to trust. In a young person, this decision happens instantly and correctly. In an older person with degraded systems, the brain hesitates. It picks the wrong input, and you sway or stumble. A 2019 study in Age and Aging quantified how often this happens. Researchers use motion sensors to track postural sway in older adults during normal daily activities. Adults over 70 experience balance perturbations, small moments where the body had to correct itself, an average of 47 times per hour while standing or walking. 47 times. Most went unnoticed, but each one required neuromuscular coordination. And when that coordination fails, even once, the result is a fall. Now here is where I want to challenge what most people believe. The conventional wisdom is that balance loss is caused by weakness. Your legs get weaker, you cannot hold yourself up, and strength does matter. But a 2020 study in the Journal of Gerontology compared leg strength to balance performance in 2,000 seniors. The correlation was weak. Many people with strong legs had terrible balance, and some people with moderate weakness had excellent balance. Strength was not the primary driver. So the myth here is not that strength is irrelevant. The myth is that getting stronger automatically improves balance. It does not. Balance is a neurological skill. It requires sensory input, central processing, and motor output. Strength is only one small component of the motor output phase. You can be strong and still fall if your sensory systems are not feeding your brain accurate information. Here is the second reframe. Most people think balance problems are caused by inner ear issues, like vertigo or Meniere's disease. And those conditions do cause balance problems. But a 2017 study in otology and neurotology found that only 12% of seniors with balance impairment had diagnosable vestibular pathology. The other 88% had normal vestibular function on clinical testing. Their balance loss was not from disease. It was from disuse. Their vestibular system worked, but they had stopped challenging it. And when you stop using a system, it atrophies. And the third reframe, people believe that if they have not fallen yet, their balance is fine, but falls are a late-stage outcome. A 2019 study in the British Journal of Sports Medicine found that measurable balance impairment preceded first falls by an average of 3.2 years. For more than 3 years, people had declining balance that they did not notice. They felt stable. They walked normally. But objective testing revealed dysfunction. And then one day the dysfunction reached a threshold and they fell. The fall was not sudden. It was the end point of years of silent deterioration. So let me walk you through the 6 mechanisms that cause balance loss in American seniors. These are not theoretical. These are documented biological processes, and each one is addressable. Number 1, vestibular hair cell degeneration. Your inner ear contains hair cells that detect head movement. When you turn your head, these cells bend and send signals to your brain. A 2016 study in Frontiers in Neurology found that adults lose approximately 20% of vestibular hair cells per decade after age 55. By age 75, you have lost 40 to 60%. The signals reaching your brain are weaker and less accurate. Your brain does not know precisely how your head is moving, and balance becomes unstable. Number 2, visual processing decline. Balance relies heavily on vision. You see the floor, you see obstacles, you see the horizon. But a 2015 study in investigative ophthalmology and visual science found that contrast sensitivity declines by 50% between age 60 and 80. You can still see, but your ability to detect edges, depth, and motion is impaired. Walking on uneven surfaces becomes difficult because you cannot see the unevenness clearly, and your brain cannot compensate with other senses because they are also declining. Number 3. Proprioceptive neuropathy. Sensors in your feet, ankles, and legs tell your brain where your body is in space, but these sensors degrade with age. A 2014 study in experimental gerontology tested vibration sense in the feet as a marker of proprioception. Adults over 70 had vibration detection thresholds that were 3 to 4 times higher than young adults. Their feet were sending almost no useful information to their brains. They were walking blind, relying entirely on vision and vestibular input, and when those systems were also impaired, they had nothing left. Number 4. Central processing delay. Even if your sensory systems are sending good signals, your brain has to process them quickly. A 2017 study in neurobiology of aging measured brain processing speed during balanced tasks. Older adults took 40 to 60 milliseconds longer to process balance perturbations than younger adults. That delay sounds small, but when you are falling, 60 milliseconds is the difference between catching yourself and hitting the ground. Number 5. Sarcopenia of postural muscles. Not all muscles decline equally. A 2018 study in the Journal of Applied Physiology found that postural stabilizing muscles, the small muscles around your ankles, hips, and spine, atrophy faster than large muscles like quadriceps. These small muscles make the rapid micro-adjustments that keep you upright. When they weaken, balance becomes wobbly even if your legs are strong enough to walk and climb stairs. Number 6. Medication-induced orthostatic hypotension. Blood pressure medications, diuretics, antidepressants, and many other common drugs cause blood pressure to drop when you stand up. A 2019 study in hypotension found that 42% of adults over 70 on multiple medications experienced clinically significant orthostatic hypotension. When you stand, blood pressure drops, blood flow to your brain decreases, you feel dizzy or lightheaded, and you lose balance. This is not a balance system problem. This is a cardiovascular side effect masquerading as a balance problem. These 6 mechanisms operate simultaneously. Your vestibular system is degraded, your vision is impaired, your proprioception is diminished, your brain is slower, your stabilizing muscles are weak, and your medications are making you dizzy. The balance system has no redundancy left, and falls become inevitable. Here is what most people do not realize. You can assess your own balance risk right now with 2 simple tests. These tests have been validated in dozens of studies. They predict fall risk more accurately than expensive clinical assessments, and they take less than 2 minutes. Test 1. Single leg stance. Stand barefoot on a firm surface, across your arms over your chest. Lift one foot off the ground. Hold it for as long as you can without touching down or uncrossing your arms. Time yourself. A 2021 study in the British Journal of Sports Medicine established age-specific norms. Adults 65 to 69 should hold single-leg stance for at least 15 seconds. Adults 70 to 74 should hold at least 10 seconds. Adults 75 to 79 should hold at least 7 seconds. Adults 80 and above should hold at least 5 seconds. If you cannot meet the threshold for your age group, your fall risk is elevated. Test 2. Tandem stance. Stand with one foot directly in front of the other, heel to toe. Hold this position for 10 seconds without stepping or grabbing support. A 2017 study in gait and posture found that inability to hold tandem stance for 10 seconds predicted falls within the next year with 78% accuracy. This test challenges your base of support and requires precise neuromuscular control. If you cannot do it, your balance system is compromised. Do both tests right now. If you fail either one, you are at significant fall risk. But here is the critical part. Both of these deficits are reversible. A 2020 randomized controlled trial in JAMA Internal Medicine tested a specific balance training protocol in adults over 70 who failed the single leg stance test. After 12 weeks of training, 82% could pass the test. Their balance had improved to age-appropriate levels. The intervention worked, and it was simple. Here is the 2-minute physical therapy fix that clinical trials have validated. It is called progressive balance training. You practice the exact movements that challenge your balance system, and you do it daily until the system adapts. Exercise 1. Single leg stance with progression. Stand near a counter or wall for safety, but do not hold on unless you lose balance. Lift one foot off the ground. Hold for as long as you can. When you can hold 30 seconds, progress to doing it with eyes closed. When you can hold 30 seconds with eyes closed, progress to doing it on an unstable surface like a foam pad. Do this exercise twice daily. 1 minute per session, 30 seconds per leg. Exercise 2. Tandem walking. Walk heel to toe in a straight line. Imagine you are walking on a tightrope. Walk 10 steps forward, turn around, walk 10 steps back. When this becomes easy, do it with your head, turning side to side. This challenges your vestibular system while walking. Do this exercise twice daily for 1 minute. Exercise 3. Weight shifts. Stand with feet shoulder width apart. Shift your weight slowly from one foot to the other. Lift the unweighted foot slightly off the ground. Hold for 3 seconds. Switch sides. Do this 20 times. When this becomes easy, do it with eyes closed. This trains proprioception and postural control. These 3 exercises take 2 minutes total. A 2022 study in the Journal of the American Geriatric Society tested this exact protocol in 800 seniors over 65. After 8 weeks, the fall rate decreased by 43%. Balance confidence increased. Fear of falling decreased. And functional mobility improved. The exercises worked because they directly challenged the systems that were failing. Another study in 2021 in physical therapy followed participants for 1 year after completing the balance protocol. Those who continued the exercises twice weekly maintained their gains. Those who stopped regressed within 6 months. Balance is not something you fix once. It is something you maintain through ongoing practice. Here is what the research shows about reversal timelines. A 2020 study in Age and Aging measured how quickly balance improves with targeted training. Proprioception improved within 2 weeks. Postural sway decreased within 4 weeks. Single leg stance time increased within 6 weeks, and fall risk normalized within 8 to 12 weeks. The system responded quickly when challenged appropriately. But here is the part most people miss. Balance training only works if it is difficult. A 2019 study in the Journal of Aging and Physical Activity compared low-intensity balance exercises to high-intensity. Low-intensity meant standing on one foot while holding a counter. High-intensity meant standing on one foot on a foam pad with eyes closed. The high-intensity group improved 3 times faster. The nervous system only adapts when it is pushed beyond its current capacity. Here are the 5 additional factors that accelerate balance restoration. Number 1. Reduce medications that cause dizziness. A 2018 study in drugs and aging found that eliminating or reducing one blood pressure medication in older adults with orthostatic hypotension reduced fall risk by 35%. Talk to your doctor about whether all your medications are still necessary. Number 2. Optimize vitamin D levels. A 2017 meta-analysis in JAMA found that vitamin D supplementation reduced fall risk by 19% in deficient older adults. Vitamin D affects muscle function and neuromuscular coordination. Get your level tested. Supplement if below 30 nanograms per milliliter. Number 3. Strengthen hip abductors specifically. A 2016 study in physical therapy in sport found that hip abductor weakness was the strongest muscular predictor of falls. These muscles stabilize you when standing on one leg. Exercises like side leg raises and clamshells directly target them. Number 4. Practice balance in varied conditions. A 2019 study in gait and posture found that balance training generalized better when practiced in different environments. Practice on carpet, on tile, on grass, in dim light, in bright light. The variability forces your brain to adapt to multiple contexts. Number 5. Add Tai Chi or yoga. A 2020 Cochrane review analyzed 108 studies on fall prevention. Tai Chi reduced fall risk by 43%. Yoga reduced it by 37%. Both disciplines integrate balance, strength, and mindfulness, and both have been validated specifically in older adults. A 2023 study in The Lancet Healthy Longevity followed seniors who implemented all 5 interventions plus the daily balance exercises. After 6 months, the fall rate dropped by 67%, fracture rate dropped by 74%, and fear of falling, which limits activity and accelerates decline, decreased by 81%. The comprehensive approach worked better than any single intervention. Your balance system is not permanently broken. The unsteadiness you feel is not inevitable. The fear you have when walking on uneven ground is not something you have to live with. When you challenge your vestibular system, practice proprioceptive tasks, and strengthen postural muscles, your brain rebuilds the neural pathways that control balance. The improvements are measurable, and they happen faster than most people expect. The full cause of balance loss in American seniors over 65 is multi-system degradation, vestibular decline, visual impairment, proprioceptive loss, central processing delay, muscle atrophy, and medication effects. These mechanisms compound, but they are also reversible. The 2-minute PT fix, single leg stance, tandem walking, and weight shifts addresses the core deficits. And when combined with medication review, vitamin D optimization, and veery practice, the balance system restores itself. If this video gave you a clear action plan, hit the like button and subscribe right now. This channel exists to give you the specific interventions that change outcomes. There is more coming about fall prevention, mobility, maintenance, and the physiological changes you can control as you age. I will see you in the next one.